Welcome back, everyone. Craig and Jeannie here. This is our second episode, I think, and I wanted to have Jeannie talk about something that's near and dear to her heart, and is going to be hopefully near and dear to my heart soon. And that's the topic of menopause. So, Jeannie, welcome back.
Thank you.
So, for menopause is one of those things that comes for all women eventually, and especially for us Catholics trying to use natural family planning and all that, it can't quite come soon enough, it seems. So with that, and we're hopefully on the cusp of that. We're still doing the whole charting thing, so we don't hopefully make any more babies right now. But why don't you tell us, Jeannie, what's broad big picture? What is menopause? Kind of what are the symptoms, and then we'll dig in.
Really simple. Menopause is when you stop menstruating
Hmm.
and about a 12-month period. Now, I've heard different reports from different doctors, but that menopause is just one specific day. And you have perimenopause and postmenopause. So before menopause and after menopause. But ultimately, it's when what's happening through menopause is your ovaries are starting to shut down, and that's what menopause is. But I think a lot of women know that, but there is a tremendous amount of fear around menopause, like what to expect. Are they going to lose their mind, like you hear so many women talk about? And again, they don't really know what to expect. So I will be more than happy to tell you what a woman is to expect, and I can share my own personal experience as well. And I don't know if I have. So if I have, and apologize if I've already shared that with you, but I think it's important for someone listening for the first time what actually does go through menopause or what happens. And I can start by telling you for myself, um, I think I was about 39 or 40. And before that, I have been very sexually healthy. So, never had an issue in that department. I haven't had any trauma sexually at all, so I've had a very healthy sex life with my husband and really good communication. And my mom communicated very well when it came to sex. That's why I'm very comfortable talking about it. But there was something that we never discussed, and that was menopause. And I don't know why, but she kept that very private. And I only knew that my mother went through a very, very difficult time when I read a book and I saw her assessment. And the assessment was she was very depressed, but she kept it from all of us girls. But I know for myself, um, I was training, I was working out, and I walked out of the community center, and within a second, and I think I was 39, but I'm going to just say 40. Within a second, it was like a light switch went off in my body, and it felt like everything just shut off in my body. And so I knew something was wrong when a woman was walking towards me, and it happened to be my neighbor. And she said, "Jeannie, are you okay?" And I said, "Yeah, why?" And she said, "You just went white right in front of me." And she goes, "Are you going to be able to get home?" And I said, "Yeah, I'm fine." I didn't want to acknowledge that something happened because I thought, well, maybe I'm getting the flu. So I get home and I could tell something. It's just like something just shut off everything in my body. I had like really no feelings really, no emotions. So as the days and the weeks and the months went by, I had like no libido, and it was very dry. It hurt when I had sex, and I was very tired. And that's what I remember mostly is I was extremely exhausted and a lot of brain fog. And then my husband was really great about it because and this is really important for people that are listening, that as a woman you need to communicate very clearly with your partner that it's not their fault, and to explain to them what you're going through, because um, I think women go through a lot of shame with what they're going through because their body's not reacting the way it normally does. And when menopause starts, um, all that's happening is that you're starting to lose your hormones just gradually, and your body's not reacting the way it used to be when you're younger, and so you don't know why, and you don't know what to do. So what happened was I was on a journey, and I was determined to find out what was going on. Went from doctor to doctor. It's the intro of my podcast. I spent thousands of dollars with no hope, and they just kept telling me I was fine, and I knew I wasn't fine. And then until I went to my primary physician, and I finally slammed my fist on the table and said, "This is enough. There is something wrong with me. Don't tell me that I'm fine. You and I need to figure out what's going on, period. And I'm not leaving here until you tell me there's hope." And do you know that he got emotional?
Hmm.
And uh, excuse me for getting emotional, but um, he said my wife is going through it, and I have no idea how to help her.
Hmm.
And she's really a mess. And he said, I decided that I'm going to spend my life, the rest of my practice, on this journey of trying to figure out this and helping women. And he did. And I was one of his first patients, and this was 18, 20 years ago. So and then I started on bioidentical hormones, and it saved my life. And every time I would go in there to see him, I said, "Oh, you just saved my life, you saved my marriage." And it was every time I saw him, I started out that way. And he goes, "Yeah, I know," because he could tell, he could, testify from his own marriage, and I could tell his marriage was falling apart as well.
Hmm.
And it was because of this. It was because
Hmm.
of the hormones, and his wife was just nasty, and but I mean, he wasn't going to go in a lot of detail, which out of respect, and I understood that, and I didn't press him on that, but I did know, and that's why I get emotional, because he got it. He got it. He knew there was, and as a doctor, he knew he had to do something and step up. And he said women are extremely complicated, and there hasn't been a lot of study and research on women's sexual health. It's been on men. It's been, studies have been on men, and men in the past, in the history, have always gone to the doctor, and if they're not performing or are struggling, they would give them Viagra and say, good luck and have fun, and usually that would help them, and that was it. And so women, because we're so complicated, and we have, progesterone, estrogen, and testosterone, um, they haven't known how to treat us. And I want to start out by saying something that uh, there was a study done in 2002 where hormones were reported as being, or as reported as causing breast cancer. And so there's been this stigma that women should not go on hormone replacement therapy. And I want to address that. I want to address that because it is really important. And I'm going to say this really clearly for any of those women listening to this: hormone replacement therapy does not cause breast cancer. And I'm making this really clear because I just had a good friend of mine who's a hormone replacement therapist, or does hormone therapy, replacement therapy, and she doesn't have any clinics here in Arizona any longer, but she goes around the country teaching doctors how to help their patients on hormone replacement therapy. And she is extremely passionate, and she started out her message, her lecture, last week on this topic about this study, and because this study um, was not accurate, and I'm going to go into detail about this so that um, people will have a better understanding of this study. Is because this was not accurate, it has caused millions of women to suffer
Hmm.
for the last 20 years to 22 years. And so what happened was that study was done by the Women's Health Initiative, and was done in 2002. And what they did was they took oral synthetic estrogen and they put it with progesterone, and it was called Primpro. And that oral synthetic um, estrogen isn't healthy anyway, and functional doctors don't use it anyway now, and they use patches and um, shots and creams and that sort of thing. And so what happened in that studies have to be done for a long period of time to gather the data. And within the first 5 years, they had the preliminary data came out and said there was an increase in breast cancer. But what happened is the reports didn't dig into the study as a whole. And that's why I want to point I just want to do a bird's eye view of that study. So what happened was they studied 10,000 women, and again, there was a small percentage that went up, and that's what they reported on that small
Mhm.
study. But you have to look at who was in that study. And the average age of the group of women they studied was age 63. And that's really important to know because what happened is those women were not protected with hormone replacement therapy until they were 63.
Mhm.
So they could have already had breast cancer already, and then it was just after those 5 years, it was detected. So they never had that protection. And really, hormone replacement therapy should be done as soon as the symptoms start, because these hormones are so powerful and so good for a woman's body, for her mind, for her heart. It's in her bones, and I can go into that more detail. So I wanted to start out with that for anyone listening that has heard that over the years and someone telling them, no, don't go on them because they could cause breast cancer. In fact, according to Dr. Angela DeRosa, who has studied this her whole career, has said that studies are showing that hormone replacement therapy is starting to reduce the risk of breast cancer. So it's a good thing, actually.
Yeah.
And so I'm sorry, I had to take notes so I don't forget anything. So I'm going to start out with estrogen. So
Okay.
women need estrogen, and what estrogen does is it burns fat, it builds muscle, and it also improves a healthy metabolism. So uh, bioidenticals, when women get replacement, the bioidenticals, that's actually a natural form, and those bioidenticals are usually made with soy or yams to duplicate your own hormones, so they're not synthetic. And what you're doing with taking bioidenticals is you're giving back to your body what's being depleted.
Mhm.
So you're giving it back because it's again starting to decrease, and a woman will start to lose hormones, actually 10 years before she actually realizes she's going through menopause. So, so it was normal for me, I guess, to start going through menopause at age 40, but I'm unusual because it was like my body just kicked me right into menopause, like within a second. There's only one other woman I know that that's happened to, and she shared that on Oprah, and I've never heard another woman say that. So some women will go very gradually,
Mhm.
and they'll say, "Oh, they never went through menopause," but they're edgy or they're dry vaginally. Well, that yeah, you're going through menopause. They're just not aware and know what the symptoms are of going through menopause. Um, um, so when the best time again to start getting treatment is when you start seeing these symptoms. And so perimenopause, when you go through perimenopause, a woman's estrogen is really going to fluctuate a lot. It's going to go up and down, up and down. And so um, estrogen and testosterone kind of cross over. So the symptoms are going to be very similar. And what's going to happen with the loss of estrogen, the menstrual cycle is going to start to change, and she's going to either start her flow will start getting lighter, or it'll get heavier. Now, I don't want to make you uncomfortable, Craig, but I'm just going to be really honest about what happens. Is a lot of women will say they'll start their flow will be a lot heavier, to
Mhm.
the point that it might even look like she's miscarrying because it's so heavy. And
Mhm.
it will just happen it won't go on forever, obviously, but it will start getting heavier over the months, and it might really surprise her, but that's normal. That's part of menopause.
Hmm.
um, and the normal things that are very common with low estrogen, now we're still on estrogen here, is she'll start developing hot flashes,
Mhm.
night sweats, her skin will start be feeling really dry, vaginal dryness, a lot of irritability. And the best way I can describe it is that you just feel like you wanna unzip your skin and just walk away from your skin, and then when you feel better is just come back and zip it back up because it's not what you normally feel. It's because of the changes, and you have no control over the hot flashes or the night sweats. They just come on out of the blue. Uh, the
Right, I've
libido
I've
what's that?
heard I've heard that, is, like, itching. Do you get, like, scratchy or itchy in certain place tingling and stuff as well?
Mhm. Yeah. Yeah, and there's all women because we're all so different, they could have different symptoms as well. In fact, a really good idea is probably to start writing those down. If a woman's listening, start writing her symptoms down.
Mhm,
The libido goes way down as
mhm,
well, and that's lack of estrogen, surprisingly. Um, and hair loss, a woman will start noticing that her hair is thinning, and again, she's losing more. She could experience a loss of concentration and a lot of joint pain too, and also weight gain. And the weight gain usually occurs in the middle of, I mean, in the abdomen. Uh, there's also if a woman is working out, she has she may not be recovering from her workout as quick as she used to, and also she could actually experience gum bleeding. And when she goes to the dentist, her gums will start to bleed, and that's part of menopause.
mm,
Now, those are the symptoms of low estrogen. So now
okay,
low testosterone, um, and again, they're very similar to estrogen, and that is mood swings and mood changes, a lot of fatigue, and low libido. The real big one is that's really noticeable is the low libido and the muscle weakness and memory loss as well. Also, with the loss of testosterone, there's a risk of osteoporosis. And that's really important to know as well because when a woman starts losing testosterone, she could have a higher risk of bone fractures and another really big one is when she loses testosterone, low libido, she may start losing that sensation um, during sex. And so if she has an orgasm, like with her clitoris, she may find she may not feel the sensation that she used to, and it'll be a lot more difficult for her to reach orgasm.
mm,
And she'll get frustrated,
mhm,
and if there isn't the communication between her and her husband, then it could be a lot of blaming. A lot of blaming may start at this point because she doesn't understand and she doesn't know why, and she's trying, and she may even say, "Hey, it never used to be like this. I don't know what's wrong." So, but it's not her fault. It's just the loss of testosterone. Um, and with progesterone usually starts to decline first. So that's what starts to decline. And a woman's going to notice this through difficulty sleeping and anxiety.
mm,
And that's a real big one with women is feeling really anxious. So the things that she was able to handle before, she doesn't have the patience to deal with it as she's losing the progesterone. In fact, if she has trouble sleeping and has a lot of anxiety or is developing anxiety, just asking her doctor and a little bit of progesterone, it could be in a cream form or a tablet, can really help her sleep at night. And it's really important for a woman to get adequate sleep because the anxiety will increase and the swings will increase if she doesn't get a supplement for that. Also, there's been known to with the drop of progesterone, infertility and miscarriages as well. And then also GI issues and struggling with digestion. Oh, and another big one too is migraines. So if a woman never had headaches, she could really experience some pretty horrible headaches and that'll turn into migraines. And that's a good sign too. And that's the drop in progesterone. Now, and I want to share two personal experiences about this, about hormones.
Sure.
Okay, so the first one is when I was, losing my estrogen and all that, and I went to the doctor, and my doctor started putting me on hormone replacements. And at that time, again, this we're talking 18 years ago, and it was very, very new. You didn't hear women talk about having hormone replacements, and hormone replacement, and if you did, they would refer to the study that would tell you that it causes breast cancer. So I never discussed it with anybody because I didn't want any judgment, and I'm going to be really bold when I tell you this. I was so miserable that when I heard that hormone replacement could cause breast cancer, I was willing to take the risk because I was so miserable.
Mm-hmm.
And I wouldn't tell anybody. And my husband was very supportive. My doctor was supportive. My doctor actually quoted um, this research, and he said it's false. And the medical field will not come forward and tell you that it's false because they have a very difficult time ever admitting when they're wrong.
Mm-hmm.
But as of today, they're starting to say they might have been wrong, but they still are not coming clean and saying that it was wrong. I mean that the data was inaccurate. It was manipulated by the media. And so, but he told me he assured me that I would be good, and I have been. I've been tested for everything, and I'm clean as clean bill of health, no cancer, nothing. So, and this is 18 years of being on bioidenticals. So anyway, I was into this about a year and a half, and he gave me these testosterone pellets or tablets because that's what we took 18 years ago.
Mm-hmm.
And then what happens is you go in and you get your blood work done every 4 to 6 months. Well, I was feeling really good, and I was having a lot of sex, and I wore my husband out, and he wasn't complaining, but he said, Jeannie, I'm really tired. I'm really, really tired. And I just couldn't get enough. I don't know. I didn't know what was wrong with me, but I felt so amazing that I couldn't believe the difference of just my whole body shutting down to now feeling like I was 21 again, and I felt better than I was in 21. And people would say it. They go, "My gosh, you just look so good, and you got all this energy." And so I took my blood test. This is a year and a half into it. I've been taking blood tests, and so I went in, and he said to get my lab work reviewed. He comes in and he goes, he's got this big smile on his face, and he said, "How you doing?" I said, "Oh, fantastic." And he goes, "Oh, I bet you are." And then he goes, "How's Kurt doing?" I go, "Oh, really, really good." But he's and I can tell my doctor anything because we've been through a lot together. And he says he's not complaining, but he's a little worn out. And he starts smiling and he goes, "Yeah, I bet he is. So let's go over your lab work. And I want to give you a bird's eye view," he said, "so you can put this in perspective. Every woman is completely different. This is why they need to go to their doctor and get their lab work done. But on the average, now again, a woman cannot take my number. These are my numbers, so she can't use my numbers. But um, a woman that's pretty healthy when she has a testosterone level. Now we're talking about testosterone, and he said a woman's level about maybe 150 would be really good for a woman. So when she's at about 10 or 20, she doesn't really have a libido. And so we want to boost that up so she has she has a libido. And now men, on the other hand, their libido or their testosterone levels at a really good level would be maybe 6 to 7, 800. Okay. And that's a really healthy guy. And he said, what I'm finding is there's a lot of stress. Stress kicks in, uh, um, you know, menopause a lot earlier if there's a woman that's under a lot of stress. So she
Mm-hmm.
can burn through these hormones very quickly. And he said, I'm finding younger women coming in, and I'm also finding younger men coming in because of their stress levels. So even men will have their levels drop. And so he says, well, let's go over your levels. Would you like to know what your levels are? And I said, sure. And he goes, you're at 1200. And I'm like, 1200. I mean, I'm more than a man. He goes, yeah. I go, "Oh, I love this. Just keep me here." And he goes, "No, as a medical physician, I cannot keep you at 1,200." I said, "Yes, let's work out a deal.
Just
We can do that." And he
how
goes,
much?
"No, we're not working out
Yeah.
any deal." He said, "I have to bring you down." And I go, and I'm begging him not to bring me down.
Give
And
me a week. Give me a week.
exactly. And so uh, it took a long time for me to work myself down. But I will have to tell you the good side of it is that I really understood what a man goes through
Mm,
because my body was just wanting sex all the time. And I was, I was constantly communicating with my husband during this time. And he goes, "I'm really glad you understand because you don't have to blame me and say that's all I want is sex." He says, "My body wants it." So I think maybe that's probably why I can relate to guys a lot because I'm not judging them. I'm like, yeah, you're not gonna understand it, but I've been there and you're not gonna believe it. But yeah, I wanted to have sex a lot. And so
mhm,
um that was a time where I knew the value of testosterone because what happens is it also helps you with your overall well-being. I slept really well. I could get up. I didn't have the aches and pains. And to go into my next story, um, I've been on them for 18 years. And um, just a second. 2 weeks ago, I found myself getting really tired and I found myself having trouble sleeping. And before I continue with the story, uh, and again, this is why it's really important that a woman goes and gets her blood work done. They might even have her do a saliva test as well, because I'm the only one that I know that doesn't take estrogen. I don't take it, and I've never needed it because I get enough testosterone that whatever's left over converts to estrogen. And he did put me on estrogen one time, and one time I just was crying all the time. And he goes, "Whoa, whoa, whoa, we need to get you off of that." And that's why it's important that you constantly work with your doctor. And it may take a couple months, maybe 4 or 6 months, for you to feel that you're uh, you're not that you're not deficient in your hormones. That you have to work it up so that you feel balanced. And so what happened was 2 weeks ago, I was getting more tired, and and it's unusual for me not to sleep. And so I woke up with really I had hot night sweats, and so I was just woke up. I was just all sweat, and then I was tossing and turning. So in the morning, my husband said, are you okay?" Because he said you weren't sleeping and you're all sweaty and everything. And I said, "I think I'm getting sick." So this went on for a couple days, and then I was in a I was in a store, a retail store, and all of a sudden I got really dizzy and my head started pounding. And this was last week. And I started spinning and I thought, I'm gonna pass out here in the store. I don't know what's wrong. And so I get home and I lay down. I slept for hours. And so I told my husband again. And sharing this with you because I think it's really important. Women constantly tell their partner what's going on with them because they'll be able to help them with a blind spot that they can't see for themselves. And so what happened was, he said, "Hey, when's the next time that you're meeting with your doctor?" Which is, this week. And I said, "This week." And he goes, "You're deficient." And he said, "With a lot of stress, you've had a lot of stress, so you must have just burned through your hormones." And so I have an emergency kit at home with the hormones that I need that I can take orally. I actually get pellets, so they inject pellets in my buttocks, and then it's time released. So I have an emergency that I can take in case. Next day I woke up back to normal again. So
mm,
obviously it was hormones. And so even though I've been on them for 18 years, when I start dipping, I have the same symptoms that a
mm.
woman that's not taking hormones have.
Wow.
Yep. So I guess I'm very passionate, so I can keep talking about this. I just love talking about this because I don't know a woman does not have to suffer and she doesn't have to struggle through this.
Um, One thing I've wondered about is I always is menopause like something you go through and then that's sort of the new normal, or is menopause this transition zone where you have all the hot flashes and all that, and then once you get to the other side, you don't have all that stuff? Is that what is it supposed to look like, or what does it typically look like let's say without hormone replacement? Is it a phase that once it's over, the woman feels relatively normal after that, or how does that typically look after menopause?
Um, every single woman is completely different. So you might have a woman that has a hysterectomy that doesn't have the symptoms, or she might have a hysterectomy and she'll go into menopause hard. And that's why it's so different. So every woman is completely different. That's why she needs to be working closely with her doctor. And then afterwards, I haven't had anything. So I've never had a hysterectomy. I never had surgery or anything like that. So I got everything, and so I'm your average woman that's going through menopause with, uh, you know, I'm trying to be careful how I use my words because I'm not trying to demean any woman that has had a hysterectomy at all. I'm
Mhm,
just saying that, I feel everything, I'm
mhm.
going through everything, and my doctor said I may have these symptoms, for the rest of my life,
Okay.
actually, and so that's why, hormone replacement therapy is so good because I do feel when I'm balanced, I really feel like I'm 21 and I'm in my late 50s and I feel absolutely fantastic, and also your hormones will actually make help you look leaner, and it'll help with your muscles. It will, it will protect you from, like osteoporosis, and there's a lot of benefits. I went through the symptoms of the loss of the hormones, but there's so many benefits on the other side, and it also does make you look a lot younger in the face, and gives you an overall well-being feeling. But for me, I don't menstruate anymore. I think I stopped about 6 or 7 years ago. But at when I used to menstruate, it was the end of the month, and I still get really tired. I still maybe get a little edgy, but if my hormones are balanced, I'm fine. But I can still feel a little tired and a little edgy, but I know what it is, and again, my doctor said I might have to deal with this the rest of my life, but I'm okay with that. I know what it is, and I manage it really well because no one else needs to suffer because I'm suffering. So I make sure my mood is good and I exercise so people are okay being around me. They don't have to worry about me yelling or being edgy, that type of thing. 'Cause it's an issue. I mean, a woman can snap easily, and I've if a woman is not getting treated, um, she may actually just feel like she's losing her mind because of the fog and she can't concentrate, and she doesn't feel well. The big thing is she just doesn't feel well all over. I mean, and it's hard, you can't tell somebody, "Oh, it's just my back hurts," or, "I got a headache." It's not. It is
Mhm.
every from the head to toe, you feel really off.
Um, so you said you were still dealing with menstruation, all that, like up to 6, 7 years ago. So that was what, 14, 15 years after you first had this episode. Um, so I guess at least for us that are using natural family planning, the question is, how do you like when does ovulation stop, and how do you know if it's stopped, or don't you
Stop.
know?
Well, you'll know when she stops having her period,
Right?
and then you'll know right then she's right in the middle of menopause. It's done, you know?
Hmm.
But it's that perimenopause, premenopause can last 10 years. And because she's gradually losing the
Hmm.
hormones. So she could be menstruating all the way during those 10 years, and then one day she stops. And then it's like, "Oh, that's odd. I missed my period." And then she may get it 2 months later.
Hmm.
But true menopause is when she hasn't had a period in 12 months. So then she's gone through the menopause. But she's got postmenopause, which means she could still have the symptoms, which I do. And I could have them the rest of my life. But they're not horrible. And that's what I want to share, make sure I'm really clear on this, is that it it's not horrible. It doesn't have to be. It's
Hmm.
just it's important that women know that these symptoms that they have or something that they can get help with, and they don't have to live with it every single day. But you watch a woman have a hot flash, and I'm thinking that woman's gonna die. I watch it. I've seen a woman right in front of me have a hot flash. I go, oh man, man, that was hard, wasn't it? She goes, yes, I want to run and hide. I go, are you on bioidentical? She goes, I don't even know what you're talking about. I'm like, well, let me help you. Let me share with you. You need to go to your doctor because you don't have to go through this anymore. And a woman won't go through these symptoms. She really won't if she's balanced correctly. That's the good news. So I've said all this horrible stuff before, but the good news is she doesn't have to go through this.
What's the you keep referring to a doctor. What specialty knows about this stuff? Like, is it just an OBGYN or is it a
No.
total different specialist?
Yeah. And they would look for a doctor that does hormone replacement therapy, and it's short for HRT. And
Mhm.
and she wants to go to specifically to that specialist because they specialize. And they're gonna do the right testing. So when a woman goes to and that's what I help women do is then I help them educate them so when they go to the doctor, they're their own advocate because you have to be your own advocate. I was for years, and in fact, that's why I'm so passionate because women will go in and they'll say, "I had all the blood work done," and she says, "I'm just fine." But I know I'm not fine. And the
Mhm.
reason why is because they're going off the blood work of the levels that have been there for 50 years. They're going off which are my grandmother, her
Mhm.
levels. And then when they were 50, life was over. Okay,
Mhm.
it's not over. And so those levels should be going, they should be looking at a 30-year-old or a 20-year-old and bump that up. And
Yeah.
so because she's 50, like, well, you're just old, you're just you're just old and you just need some, I don't know, Tylenol or an antidepressant. No, that's not what she needs. And
Mhm.
that's why she needs to go to a specialist who will do a full female panel on her and look at even her thyroid because if her thyroid is not where it should be as well, it's not her hormones, the replacement isn't going to be effective. So they also have to make sure that the hormone is balanced as well. And I have that done too. So I take medication for my thyroid. That's the only medication I take besides hormone treatment.
Is the panel something that um, can or should be done before a woman really starts going into menopause? Maybe towards the tail end, you're still ovulating somewhat regularly, theoretically fertile, or is it something that needs to wait until you really are showing obvious signs of menopause?
No, I would recommend getting it, especially if a woman's in her 40s, definitely getting a full female panel. That way, she can get her lab work back, and she
Mhm.
can monitor it, and she can see the levels. And if she has a really good doctor, a hormone replacement therapist doctor will go over her panel with her and tell her where her um, testosterone levels at, her progesterone. She'll tell her, and that's what you want. You want if your doctor doesn't do it, you want your doctor to go over that with you. And again, um, if she's in the correct range, so if she goes to a general practitioner and they get the report back, they'll say, okay, well, you're in the right range. And let's say she's not feeling very well, but an HRT doctor, hormone replacement doctor, is going to look at those results, and she may be at the right level. But if the doctor brought it up a notch, like gave her a little bit of testosterone, progesterone, and gave her to the brought her to the top, she may feel a world of difference.
Mhm.
But a lot of doctors don't do that because they say, well, you're in the right, you know um
Yeah.
in right zone. I mean, and you're fine.
How? Let's say on the beginning end, let's suppose a woman starts having the panel done. How frequently do they have those? Should they have those done before they actually start taking it? I know once you're on it,
um,
you got to do these regular tests, but
Every doctor is different, but, I'm not really sure about that because I only because I've been doing this for 18 years, I know I get checked every 5 to 6 months.
mhm.
So, and that it's because I'm on them. But
Yep.
I don't see at all why she would have to get that her blood work because blood work is expensive if
Yeah.
you don't have good insurance. So, another thing is, when I first started out taking these, I had to pay out of pocket, and I've paid out of pocket for these because the insurance didn't cover, and I could have probably bought paid cash for a house for the money I spent, but I'm telling you something, it was worth it. It saved my marriage, it saved my sex life. It was everything about it. I have absolutely no regrets at all. And I would do it all over again if I had no money. I would work 3 jobs because it's that important to a woman's health.
Do you know if a woman starts taking these supplements or whatever you want to call them, the therapy when she's beginning menopause, but let's say still fertile, still ovulating, still at risk of getting pregnant? Do you know if this prolongs fertility? Does that stave when she stops ovulating, or does it have any effect on that? Because that's what we all care about.
Well, she might be really fertile, I'm telling I wouldn't expect that she's not. If she doesn't take bioidenticals, her chances of not being fertile are gonna that's a greater risk, and miscarriages and being infertile if she doesn't. If she does take them, yeah, I would be careful. So she'll be very active. Yeah. So
Okay.
it's not until the safe zone is when she's not menstruating any longer. That's when you're safe. But until then, you're not safe. I'm sorry.
I'm not sure I'm going to be safe even after that, but we'll see.
I know, right? Oh, that's funny.
Okay. Okay. And well, that's anything
Oh,
else you want to add on this while we're on the topic?
I do. The only thing that I'm aware of is that testosterone, this is for men and women, is that it can thicken the blood. So it could cause blood clots. So it's important that maybe
Mhm.
to remember to give blood, and that just thins out
Oh,
the blood. So, I don't know, I think you can give blood like every 2 months or 3 months. I'm not suggesting that you do that, but if you're, but I do, I give blood every 6 months, and I can feel the difference. I can feel my body lighter,
really?
and yeah, and I would highly recommend that for anyone, to do that.
Okay.
Um, and also, I don't think I said this, but Dr. Angela DeRosa said that these hormone replacement therapy is also showing it's preventing dementia and Alzheimer's because it affects the brain. Brain affects the brain, the cardiovascular system, and gut, memory, all that. So these in the muscles. So what's happening is the hormones are really preventing a lot of future diseases that women may experience.
What's your and if you know at all, like what percentage of women, let's say in the West, in the US, whatever, are actually going on this therapy? Is it still a fairly small percentage, or what
Mhm.
is the
I think it's
how,
still small.
mhm,
All my friend well, now it's different for me because I'm always talking about it, and people in my world watch me, and they don't like to ask questions, but they just watch my behaviors. And so they are like, okay, that works for Jeannie. So I better check this out. But they're just so stubborn. I got really prideful friends because, and I can tell you that, and they'll own up to that, but they'll never go see my doctor. They'll
mhm,
go and find somebody else. And
mhm.
so but all of my friends are on bioidenticals, every single one of them. And because they see my relationship with my husband, they see it's healthy. They see that we communicate really well. They know we have a lot of sex. They ask and I tell them, and so then that's what they want. And I've heard people tell me, I want what you guys have, but they don't. I think sometimes they think that it's just the marriage, being married a long time, but no, it's in a relationship. You have to keep yourself healthy. You have to, um, keep your hormones at a level that you do want to be intimate. Because if you don't keep them at that level, you're not going to desire sex, and then you're going to blame each other and start fighting, and then the distance occurs, and it just gets messy. And
Yeah.
a lot of divorces occur, after people have been married 25 years, and that's happening. And I know that this is a newer thing because I listen to a lot of doctors. I listen to a lot of podcasts and read a lot of material from, sex therapists or MDs that are specializing now in sex therapy. Um, and coaching, and they're just coming out and talking about this now, and several of these doctors are saying, "Oh, this is the first episode I've ever done on women's sexual health." I'm like, "Oh my gosh!" And I've been doing this for 18 years, and I'm not a medical doctor, and I struggle sometimes because I don't have the MD behind my name, but sometimes I think it's better. And I'll give you an example is I lived it. So I'll sit and listen to women and say, "Hey, this is what you need to go tell your doctor. This is what you need to explain to them how you're feeling." Because do you know, on the average, when a woman goes and goes to her doctor and starts explaining her symptoms, do you know that the average is a doctor will cut her off in the average is in 11 seconds into that conversation. So she's got 11 seconds to try to get her um, symptoms out to the doctor for him to diagnose. And so that's why they always say, okay, well, I think you just need a glass of wine and an antidepressant. So they're really not digging in to find out what the root of the problem is. And this will change so many women's lives, so many women's marriages, because when when you are feeling really good, you know you're more productive and you're more happy and you have a better relationship and a better life, and you're more successful when you're feeling better.
Win, win, win.
Yeah, it is for everyone. It is. Yeah. I don't agree with synthetic hormones though. I mean, because I think they're still out there, but no, that's the stuff you want to stay away from. And also, uh, some women may go on threads and read women that will have ideas. Well, you need to take this herb, or you need to take this supplement and that. And the amount of hormone replacement therapy I need, the dosage I need, is a medical dose. There is no cream on this universe that's going to give me what my doctor prescribes, because it's specially made in a compound pharmacy. So it's specially made for me and the dose that I need. And so it's important that women go to their doctor and
Mm.
listen to their doctor, and they can hear the knowledge from me, but every single woman needs to be um, looked at individually, because she's an individual. She's unique. She's special, just the way she is, and needs to be given the correct dosage for her. So don't be listening to anybody else saying you need to take this cream or this cream. That this is where it's important that you go see a medical doctor that you trust.
Is there kind of getting back to the question about the specialty? Then is there a particular board certification or just group that someone could look up if they're looking for, like, I don't know if there's a doctor with a specialty in my area. I don't even know where to start. Is there a resource for people that can go and try and find a doctor?
You know what's interesting? I had this feeling, I had this gut feeling you were going to ask me that question, and I don't know the answer to that. And so I will be visiting my doctor, and I will get back to you on that, because
Yeah,
I'll ask her,
yeah.
and very specifically, and I've actually had people fly in here to Arizona to see my doctor,
Mhm.
but that's not something I would ever encourage, because and that's why Dr. Angela DeRosa travels all over the country to educate doctors. So I'll reach out to my doctor was trained by Dr. DeRosa.
Okay.
So I'll get back to you on that information, because it's a really good information.
Yeah, and if you have like any particular good resources you like, just send them over, and we'll include them in the description below, or update the description below. And
Hmm.
I have a feeling that what we should do is give people a chance to hear this episode, digest it a little bit, and then if people have comments, things that they would like to know more about, leave a comment below or get a hold of us somehow, send us a message, and we'll be happy to do a follow up. Maybe we can get someone else on and do an interview with us to answer some of those questions. But I think this gives people a good dose of
Hmm.
information to start. Now, obviously, if you have some key things that you want to cover before I wrap up, but I do want to encourage people to kind of digest this. Husbands, share this with your wives.
Hmm.
Mother, women, share it with your mothers, etc. If people want to get a hold of you, is it talktojenie.com? Is that the way to schedule something with you?
Yeah, but I find that people are a little afraid at
Mhm.
first because you really want to build trust with someone, and I don't blame them, you know.
Mhm.
And so I would really suggest people listening to my podcast, and and if they feel that they can connect with me, like okay, I trust her, you know, she's going to be honest with me. Then I would go to talktojenie.com. But my podcast is Maximum Desire, and it's a little bit more challenging to find nowadays. Yeah, so you can do that or Google my name or put my name in, and you'll find me. But I think it's important to listen to those episodes, and then when you build trust, because I help women, um, get them. I help them prepare them for the doctor's visit so that they can be their own advocate, and write it down what they're feeling, and a lot of times women don't know what they're feeling until they have someone that can help them with their blind spot and say, this is what it is and you're normal. And I think the most important thing women need to hear is it's okay. It is, and you're normal, and you're not broken. You're normal.
If you if you have any of those particular podcast episodes where you kind of really wade into these issues, I know you talk about it a lot, but if there's
Mhm.
a few particular episodes, send them over to me. We'll go ahead and include those in the description as well, so that people can, find the ones that are going to really start them down the right path.
Yes, I sure will.
All right. Well, Jeannie, I knew this would be right in your wheelhouse, and I knew this was something you're passionate about. So thank you for coming on. I learned a lot, and I'm um, somewhat nervous, but also hopeful that we'll be in this realm here pretty soon in our lives. So
Hmm.
we'll have to do it again. So we'll wrap this up. Do you have any thoughts on what we should do on our next episode? What's your next
Well,
burning topic that you want to talk about?
you know, um, as we're closing, I just want to say I want to just give hope to everybody out there that
Yeah.
this could be the best years of your life because they're mine. I mean, these are my best years, and not to listen to everybody else because I've been listening to some women that are so scared. They're so afraid of menopause. You don't have to
Yeah.
be,
Yeah.
at all. All you want to do is think. You got to think, I am going to overcome this, and I'm going to get help. So I feel amazing because you want to feel better than you ever have in your whole life, and I do. So that's what your goal should be. So um I'm open to talking about sex during menopause, or and even suggestions on how to make intimacy better during menopause.
Awesome. Well, we'll talk about that. We'll cover one of those topics on the next episode, maybe in a week or so.
Good.
So okay. Well, thank you, Jeannie. Anything else you want to add before we wrap up here?
No, I just want to thank you for what you're doing. I think this is amazing, and I think anybody listening needs to share these episodes that you're doing with other people, because then they won't feel that they're alone. I think people are really struggling out there because they feel left they're alone, and they don't have to be.
Yeah, we're gonna hopefully start bringing more of this content to you on this channel. So do if you find it, please like and subscribe and share it around. And certainly, if you have people have questions or ideas that they'd like us to talk about, things that maybe most people are just afraid to talk about, let us know. Between me and Jeannie,
Oh,
we'll
we'll
talk
talk about them.
about just about anything.
Yeah,
So
we will. I would
here's your
love.
chance.
Yeah. There's
All right.
there's some sexual stuff I don't want to go down, but because there's some people that are out there that are a little bit over the top. They can go someplace else for their topic, but I'm
Yeah.
pretty straightforward and on the
Yeah.
average
Yeah.
sex relationship between a husband and wife. Yes, I'm all
Awesome.
in.
All right. Well, thank you, Jeannie, for all that. Thank you for everyone for listening. And until next time, everyone, have a good one.